the information about soy-based foods, things like tofu, edamame, soy milk, their effects on women who may be at risk for breast cancer. It's been so confusing. Is it good for us? Is it bad for us? Now there's some more information out there, Dr. Funk, right in your wheelhouse, dealing with patients who have or are at risk for breast cancer.
Right, so soy has this plant-based estrogen, isoflavones, which are a little confused, it turns out. In some parts of the body, they act like estrogen, and in other parts, they're an anti-estrogen. This is important because in 2017, about 255,000 women will get diagnosed with invasive breast cancer this year, 75% of which is cancer fed and fueled by estrogen. So which is it, soy? Are you going to feed these little monsters, or are you going to actually protect us from them? There's a new study published this week in the journal Cancer, looked at 6,200 women, followed them for just about 9.2 years, looking at a number of factors, but soy being one. So this is extremely interesting. It turns out that high soy consumers versus low soy had a 21% drop in breast cancer incidence and recurrence for breast cancer survivors. And then a little twist, there was a 50% drop in estrogen-negative cancers, which makes very little sense, right? Estrogen-negative cancers could care less about being fueled by estrogen, suggesting that soy also has some anti-inflammatory, antioxidant capacity that we don't yet fully understand.
So what do you do when you're a consumer? Because we often talk about how healthy plant proteins can be for us as humans. And soy is ubiquitous now. It's easy to get anywhere you live.
Go with the edamame and you love it.
It is good.
Yes and no.
Edamame is wonderful. But so if you're a woman, and men think about the estrogen effects as well, what's the takeaway for them when they're going to the store, going out to dinner? What's the right amount?
Right. So interestingly, this study, on average, people consumed on average 1.8 milligrams of soy. Reference, a cup of soy milk has 27 milligrams. So apparently 1 cup worked just fine for 2 weeks for these people. These were not truly high soy consumers. So what I would say is everything in moderation. You don't need to like spit out your miso soup when you remember what I just said. It's totally fine.
A lot of people
edamame, tofu.
Soy milk. A lot of people
use
soy milk as a substitute now for dairy products, myself included.
Moderation, not 5 pounds of tofu for lunch, right? Just
Isn't it remarkable how every study that comes out seems to continue to support the boring mantra of everything in moderation?
Yes.
I thought the same thing.
Moderation. So, Chris, a quick question. How about an estrogen effect from soy in men? Is it a cause of gynecomastia? Is it...
Again, in excess amounts. You would have to, like, literally be taking baths in tofu to get gynecomastia from...
And have the estrogen effect of gaining weight, potentially.
Exactly.
Maybe good for your skin, though.
But I think it also highlights, when it comes to breast cancer, every woman's experience is individual, and having a plan in place with your doctor, making sure that you're doing the exact right things for your specific type of breast cancer. This is fascinating and I think a really interesting study. We'll have more information on our website.